On the remote coast of Nicaragua, a 19-year-old suffers a third day in obstructed labor. A rough boat ride to a distant hospital is her best chance to save herself and her baby. In Grenada, a little girl battles diarrheal disease, a killer of 5,000 children worldwide every day. And in Managua, a woman fights late-stage cervical cancer. The tests that might have caught it early aren't available where she lives. Everywhere, these struggles touch billions of people daily, in a world where good health is easily available to some, but out of reach for so many. This is why PATH works, to break those barriers through innovation in technology, health systems, and engaging communities, to be the place where solutions start. In the rural Nicaraguan town of Tisma, 33-year-old Vilma raises 7 children, the youngest just 3 years old.
I wash, I clean, I iron, I go out to work.
Vilma had never even heard of cervical cancer until her diagnosis, after months of bleeding and pain. Now, she doesn't know if she'll survive.
It hurts and I want them to operate and take it out because I have to take care of these kids going forward.
In wealthy countries, women are screened with regular Pap tests and get prompt treatment. But in Nicaragua, only 10% of women have access to tests. The country has one of the highest cervical cancer rates in Latin America.
In reality, when we detect this problem, it is already very advanced, and the result is many orphan children.
Vilma now waits for referral to the country's only women's oncology hospital.
I hope they can give me more life and some help. If they can't, what do I have to look forward to?
But help has arrived. PATH has partnered with the Nicaraguan Ministry of Health to introduce a new rapid test for human papillomavirus, the primary cause of cervical cancer, and to encourage women to get tested.
My dream is that we manage to catch this early in these women and stop it before it advances so that we can save lives.
PATH believes all women deserve the chance for early screening so that Vilma and millions of others can defeat this treatable cancer, and their daughters can grow up and live free from the fear and pain of this disease. In a hospital in Grenada, 2-year-old Wilson is weak with diarrheal disease, most likely from contaminated water. With widespread sanitation problems, diarrhea has been the primary killer of children here. But PATH helped turn that around. In 2006, the Nicaraguan government worked with PATH as it introduced a new vaccine against rotavirus, one of the deadliest causes of diarrhea. For the first time in history, a vaccine reached one of the poorest countries on the planet at the same time as the industrialized world, rather than years or even decades later. As a result, health centers in Nicaragua treated fewer kids for diarrhea, and now, hospital diarrhea wards are often empty. Wilson's made a full recovery, and 80% of babies in Nicaragua now get the vaccine, meaning a dramatic drop in children with severe illness, fewer families suffering this ordeal, and many more healthy children. A major success story. In Ciudad Sandino, Nicaragua's poorest municipality, unemployment, alcohol use, and despair worsen patterns of violence against women. Abuse that shatters women's confidence and safety and can ruin their health. Tragically, young people see so much of this violence, they accept it as normal. So PATH and our partners are developing innovative new programs for young adolescents ages 10 to 14 about sexual health, gender violence, and the roles of men and women in society. The effort was so successful with girls that a boys program was added called Entre Amigos, or Between Friends. Young people are trained to teach their peers how to prevent HIV and pregnancy, as well as how to have healthy, respectful relationships. 15-year-old Jonathan was once a troubled boy who got into fights and treated his mom with contempt, refusing to do what he called women's work. But becoming a peer educator turned his life around.
He aprendido que la violencia no deja nada bueno.
I've learned that violence doesn't lead to anything good. I help my mom. I treat people respectfully, and I'm not the rebellious and violent kid I used to be.
3 years into the program, Jonathan now volunteers to cook and do laundry. His mother says it's like getting a new son.
Sin palabra.
There are no words.
She can barely express how proud she is.
Hay madres que me
There are mothers who say, "Give it to me as a gift because I want a son like yours."
como el tuyo.
Entre Amigos develops future leaders and has the power to end gender violence so that all children can grow up in safe families and a society that respects men and women. All over the world, this is PATH, where solutions start, from life-saving technologies to healthy behavior changes. Individuals and communities taking charge of their health and their future. The progress in global health is real. The possibilities are limitless. That's why we ask you to join us at PATH, so that good health is not just for the fortunate few, but for everyone. Solutions start at PATH, but they also start with us. Together, starting today, we can build a world of health and hope.